One of our big goals today was to help you feel a little bit better about terminology, about people throwing out stuff that you don't have any idea what they're talking about, and hopefully talking about subsidies and tax credits and marketplace and exchange, that we've done some of that. But also, we wanted to provide you with facts, and hopefully we're doing that. We're not done yet here. I know I got the kind of the tone like I'm wrapping up, but I'm not. But I wanted to follow up on, there's been a lot of rumors coming out on the internet especially, but in the newspaper too, that are talking about the security of the websites that are set up right now, okay? And we know that every precaution that's available is being taken to make sure that the websites that are being created are not going to be able to get hacked into, okay? But the problem is they are doing so many different things so fast that I don't believe that it's possible to have the world's best hacker try to hack in until next Tuesday. And we won't know if the hacker was successful till Wednesday or Thursday or Friday, okay? I'm cautioning my customers. I'm saying, I would love to see you on October 1st to have a cup of coffee and talk about some things, but I'm not going to recommend that we sit in front of the computer terminal on Tuesday morning to be the first one to rush out and sign up for this, just in case there really is a security issue, okay? If a state says we're going to push it back 2 weeks, it probably means that they're being prudent. And they want to have some hackers try to hack in, and they want to have a chance to fix the problems before they happen, okay? So if you hear that the date is pushed back, I'm pretty sure the site will be available on Tuesday like it's supposed to, okay? But I'm not going to recommend anybody that I know actually try to put your own personal information in there right away. Okay, you've got until December 15th. There's several different dates to know about, and there's some weird things going on. Is there anybody in here that doesn't have a checking account, a debit card, or a credit card? Your first payment when you enroll needs to be paid electronically at the time that you complete your application. And if that's not completed by December 15th of this year, if you qualify for a tax credit, you won't get it in time for January. Okay? You might be able to enroll with the carrier on December 29th and have your coverage start January 1st, but if you qualified for the tax credit, you're going to pay the full premium that first month because you didn't get the electronic part, which is going to trigger the government doing their part. That's why the government says we need a couple weeks to figure this out and get the other portion of the money to the carrier. Okay? So October 1st is the first date that you could go in and do something. I'm going to recommend a little bit of caution there, okay? But you have until December 15th, okay? I think of Halloween as being a great time to do it, Thanksgiving another great time to do it, and before you put your letters out for Christmas this year. That definitely before December 15th, okay? But there actually have been, I mean, the state of Washington looks like they're about 2 weeks behind, and the state of Oregon looks like they're about 3 weeks behind. And we started later than they did, but I don't think we're falling any further behind than they are. And they're just doing this to be prudent. They're just doing this to be safe with your information, and I see that as a good thing. So if you do want to rush out, or if you know some young people who are just technology people and they just can't hold themselves back, hopefully everything will be fine and they won't have any problems with that. But we're just not recommending that people rush out and do that. Okay. We're going to go through another couple of examples, but the blue one hopefully gave you a pretty good idea of somebody who qualifies for a nice subsidy and ends up getting insurance for a low price, and yet they have options to get insurance for even a lower price. Now what I didn't do was, of course we could go the other way on the chart. Instead of paying $65, maybe they want to pay $165 and get a better program. You're certainly going to have the right to do that as well. You can buy up or you can buy down. Yes, ma'am?
I did some research on this a week or so ago. And on the top of this blue thing here, it says zip code starting with 838. Why is it different for southern Idaho than north Idaho?
You know, my favorite questions always begin with the word why. Now, I can never answer those questions accurately, but I could make up something that would sound good. It's interesting. Regions Blue Shield of Idaho has had 8 regions in their pricing scheme for years and years and years. And different areas have different rates, and North Idaho has had typically lower rates than some of the other parts of the state. The federal government said that when these programs get put together, that each state could be divided up in several different ways. And one of them was, and 7 was the magic number the government gave us, said if you'd like to, you can cut your state up into 7 regions. So what we did was we took, there's only 838, 835, 834, 837, there's only 8 different starting prefixes in Idaho. They took 2 of them and combined them. I think it was 6 and 7 or something, but it wasn't ours, but they took 2 of them and combined them, called that one region. They took our 8 zip codes, turned it into 7 regions. Evidently, the cost of healthcare is slightly different in some parts of the state than it is in others.
I'm always curious as to why. I worked at the state agency and we weren't always offered the same thing that Boise was.
Yeah. Costs are different. I don't know the why and the where and the how. Okay, so what we did on this, and again, I mentioned earlier that this chart, we always kind of go back and forth with this chart. On the chart, it says a married couple, a household of 2, can earn up to $62,040. And they are pushing right at the outside limits of 400% of the federal poverty level. That's what it says, $62,040. So we're going to do an example here of a household that has 2 people in it. The household of 2 people makes $62,000. So if they get a bonus at the end of the year, they're going to make too much money and lose their tax credit, aren't they? Okay. So they're bumping the outer limit. We have a couple, they are 61 years old and 55 years old. The government says that they are exactly right at 400% of the federal poverty level, and their premium is about $600 a month each. 600 each times 2 people is about $1,200 a month. This, which is about $14,000 a year. This shows $15,000. So their premium is $600 or $700 a month each. That's the total premium. However, the government says $62,000, you should only have to pay 9.5% of your income. 9.5% of $62,000 must be $5,890. So again, the government has predetermined this household of 2 is going to get insurance for $5,890. I'm going to round that up to $6,000, easy math. 2 people, $3,000 each. So they get $250 a month for his insurance, $250 a month for her insurance. Why wouldn't they do that? Okay, now the bottom number here, you could receive a government tax credit subsidy of up to $9,300. So in order for them to get insurance for $6,000 a year, somebody has to pay $9,000 a year, but fortunately for the couple, it won't be them. Okay, so if this happens to be you, and I actually priced out a couple in Idaho that are 64 each. In Idaho, a 55-year-old and a 61-year-old actually pay less than this. But if you were both 64, these prices are very accurate to exactly how the plan would work for you. Almost 2 64-year-olds work exactly like this. They get about a $9,000 subsidy. Okay, so their insurance is $6,000. However, next month, one of them is going to turn 65. Now, only one of them is going to get insurance. So right now, their insurance, because of their income, is $3,000 a year for each one. Now, one of them turns 65 next month. So how much is the premium going to be for the remaining member of the house who is going to be still purchasing their insurance through the marketplace because their spouse is now on Medicare and doesn't qualify? Is it going to be 0? Is it going to be $6,000? Or is it going to be $3,000 for the one person? It was $3,000 each before. It's now going to be $6,000. So the premium is going to stay the same even though only half as many people get covered now. Who thinks that's fair? Okay. Unintended consequence of the way the rules were written. The law didn't say when somebody becomes eligible for Medicare, we should still charge their spouse the same amount they were paying before and make the other person buy Medicare and a drug plan and a supplement and all this other stuff too. Their expenses are going to go up when they get Medicare. Right now, most people before Medicare are paying $400 or $500 a month, and when they get to Medicare and get it for $250 a month, they think Medicare is the best thing since sliced bread. But now they're going to say, let's not have a birthday party this year. Let's stay 64 for a while. Tell the government that. Okay? So that's not a very fun situation to be in. Okay?
You don't have to buy into Medicare, do you?
when you're eligible for Medicare, if you're eligible for Medicare, if you're eligible for Medicaid, if you're eligible for government insurance, you cannot qualify for any kind of a tax credit at all. So, no, you don't have to buy into Medicare either, but you lose eligibility for this if you don't go on to Medicare. So, I think you kind of got to buy Medicare. Okay. When you leave here, we're not quite wrapping up yet, but I got to go through the bad news now. But before I do that, I'm going to encourage you to please read everything you see on the blue sheet, but probably even more important is everything on the red one. Okay. This information was compiled by the Kaiser Family Foundation. The Kaiser Family Foundation is one of the largest organizations that has data on healthcare, and they are way, way up on whatever's going on in healthcare reform all the time. They've got some notes in here, and they're frequently asked questions. Their frequently asked questions are pretty good, but the answers they give are really good. They're gonna inform you a lot about healthcare reform that you're not learning from us today. So I really encourage you to read the rest of this information. It will help you better understand the whole program. Okay? So please do that. But the Kaiser Family Foundation, they run off of donations and government grants. So you guys, and they're the ones who created the U-Tunes video that we watched. Okay? So don't be afraid to read this, use this, go to their website, look up more information. Their information is going to be about national. And every now and then it will do things like say, these states have expanded Medicaid and these states haven't. And these states, it'll tell you that, like in Idaho right now, it's actually being discussed. There are some states that have said there ain't no way ever, 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 but Idaho, it's being discussed. There's other states that actually have bills going through right now trying to pass Medicaid, and so they're better discussion than we are. But that information, that site will be really good. Okay, yes ma'am.
We're talking about couple, one turn 65, but they still pay the same premium.
Yes.
It's always January to December, I assume.
Well, if that person turns 65 in March, that person goes on to Medicare in March, and the other person's still going to pay $500 a month for the rest of the year for their health insurance.
How does that work for a single person that turns 65 during the year?
Well, they lose whatever tax credit they were getting that day, and they begin Medicare that day.
So I have a birthday in January. I wish I was born in December.
Well, if your birthday's in January, and you turn 65 next year, this isn't going to affect you, because you're going to go on Medicare on January 1st. Medicare starts the first day of the month you turn 65, unless your birthday is the first day of the month, and then it starts a month earlier than that. Okay, so if you're a Medicare person, yeah.
Baby, you.
They'll change it all in 5 years.
Yes, of course. Yeah. Okay, but back to this. What we did here was an example of two people earning $62,000. I don't know how many of you are self-employed. I don't know how many of you have a side business. I don't know how many of you are semi-retired, retired, whatever, and have maybe the ability to control your income to some extent. Okay? If you think that you and your spouse might make $70,000 next year, and you're expecting that $10,000 of that is going to come out of your IRA or your 401k, you would be prudent to pull that money out in December this year. By pulling the money out in December of this year, instead of making $70,000 next year, you're going to make $60,000 next year. At $60,000, you qualify for a tax credit. At $70,000, you don't qualify for a tax credit. Okay? The other thing, and probably the least fair, we can make it more complicated. Okay, and that's why we say that before you sit down at the computer and say, here's how much money we're going to make next year, you might want to talk to your tax advisor about it. Hopefully, if you're making $70,000 and you have that money coming out of an investment account, your advisor will tell you that before you sit down at the computer too. Say, when you get to that insurance guy, tell him $60,000, tell him $50,000. But then you want to make what you said you were going to make too, so you don't owe a big penalty at the end of the year. Okay, but remember the other side of the chart here is the people who are making $10,000. A person in Idaho making $10,000 will not qualify for Medicaid. They don't qualify for free insurance. They're also not on the chart. That means they don't qualify for a subsidy. They don't qualify for a tax credit. They have to pay full price for health insurance or face a penalty. Maybe. Not really. Okay? Let's say that they were 57 years old. Remember the 57-year-old insurance was going to be $413 a month? 413 times 12 is $5,000. If you're making $10,000 and you're 57 years old and your insurance is $5,000 a year, do you think it's affordable? It's 50% of your income. The government says that if the second lowest price silver plan available in your geographic area is not affordable, based on your income, if it's not 9.5% of your income or less, the government won't make you buy insurance and you won't have to pay that pesky $95 penalty. Okay? So they won't be required to have health insurance. The bad news is they won't have health insurance. If they go to the hospital, they don't have health insurance. If they go to the doctor, they don't have health insurance. So at one of our earlier meetings this week, one of the ladies said, well, my brother-in-law is a farmer. Okay? He makes $200,000, but he had all these expenses this year. He's going to show $0 in income because he had $210,000 in expenses. And I said, you might want to have him lose a couple of receipts because he's going to be much better off to only have $188,000 in expenses against his $200,000 income so that his net adjusted gross income is $12,000. Guess what? The person making $12,000 qualifies for a tax credit. Okay? If you're making $12,000, the government says you're supposed to pay 2% of your income to buy health insurance. Your health insurance is $20 a month. It's 2% of $12,000 is $240 a year, $20 a month. Now, if he has lots of money, and those were fake expenses and he really made $200,000, maybe he should just pay the full premium and buy health insurance. Okay? But if you know somebody who's making $10,000 this year, it would behoove them to figure out how to make $11,500. Because if they make less, they may not owe a penalty because insurance may not be affordable, but they won't have any coverage. And for $20 a month, if you make $12,000, your premium is going to be $20 a month. By the way, I went to the IRS tax chart. There's probably a few CPAs in here. If you're a single person and you make $12,000, you get a standard deduction of $5,950. You get an exemption of $3,700. Or $3,800. So you get to deduct $9,700 against your income that was $12,000. Your total tax liability for the year is $2,250. When I went to the tax chart, your tax is $240. A single person who makes that kind of money qualifies for a credit. It's called an earned income tax credit of $175. So they can subtract $175 off the $240 they owe the federal government, and their total tax liability for the year is going to be $65. So if they pay the federal government $65 in taxes, okay, they're going to now get health insurance for $20 a month, and they're going to have great health insurance because just as this person here had 87% coverage, the person making $12,000 is going to have 94% coverage.
Better than a flat.
Better than any insurance you've ever had. Okay, so I don't know where the money's coming from, okay? I hope that somebody somewhere is going to donate a whole bunch of money to pay for this stuff. But for the consumer, if you're the person on the low end of the income scale here, I know that you're looking forward to health insurance, and it really would be a sad situation if you had a single person making $11,000 that didn't realize they could have had great health insurance if their income taxes said they made $500 more that year. Okay, they could have really great health insurance. It would be sad if they didn't know about that. Okay, I talked about bad news. Is anybody in here married? Anybody here ever going to get married? Okay, the government just gave us one more incentive, one more reason why not to get married. Okay, oh yeah. I talked about, there used to be something when you filed your taxes, and we all called it the marriage tax penalty. What that was is, I mentioned that the standard deduction for a person today is $5,950. For two people, it's $11,900. It's exactly double that. It didn't used to be that way. It used to be that a single person got this much and a married couple got this much more. Okay? They fixed that and made it fair. This right here is very unfair. If you know a young person or anybody who's engaged, thinking about getting married someday, and they're making $30,000, but they're engaged to somebody who's got a great job and they're making $40,000. Right now today, the government's going to make sure that they have affordable health insurance by helping to contain the cost of their health insurance. Okay? He's going to go over and say, honey, if we get married, we lose that subsidy. Why don't we keep living in sin for a while? I'm having fun. Okay? This is not, this is not going to encourage people to get married. It's going to encourage people to keep getting extra help from the government. There's going to be people that are going to lie on their taxes. The IRS is going to hire more agents and come after you. There's going to be people that finagle and do all kinds of weird things to try to get better, more, whatever coverage. Okay? And it's unfortunate, but part of it stems from the fact that one person can make $11,490, but when you have a spouse, you only get $4,000 more dollars. It's not double. It doesn't go from $45,000 for a single to $90. It goes from $45,000 for a single to $62 for a couple. And when you add in the kids, it doesn't go up much either. So it's unfair to the married couple in comparison to what it does for the single person. Okay. Now, the part that is absolutely the most controversial. We saved this for last, and I'm sorry that the people that left won't get to hear it. This is the absolute most controversial and the part that has the most people running their tails off right now trying to get it fixed. Okay? There are people trying to help us make this a better situation for people. And what it is, just as we've seen a married couple here that can get insurance for $6,000 a year, or a single person that can get it for $775 a year, okay? If you go to your cul-de-sac and there's 5 different families in here, and they all make exactly the same amount of money, okay? Let's take off of here a family of 5. One person in the family has a good job and makes $50,000, or 2 of them are working together and make $50,000. If they don't have any health insurance coverage offered to them by their employer, then they're going to qualify to buy health insurance through the exchange. Okay? At $50,000 for a family of 5, that puts them at a level of about 180, 190% of the federal poverty level. They have to pay 6% of their income per year buying health insurance. 6% of $50,000 says their insurance is going to be $3,000. Okay? That family that's probably has a stay-at-home mom or dad, probably has one person working a lot or 2 people working, they're going to be ecstatic when they find out that for $250 a month, they can cover 5 people with really good insurance. Okay? Now, their neighbors across the cul-de-sac, they're also making $50,000. There's also 5 people in the family, but he got lucky. He got a job that gives him free health insurance. His employer pays 100% of his health insurance. And the employer says, oh, by the way, if you'd like to add, I'm going to pay 100% of your premium. That's $400 a month. By the way, if you'd like to add your wife, that's another $400 a month. By the way, if you'd like to add your kids, that's another $300 a month. So he's being offered insurance, and for $700 a month, he can add his wife and kids to it. Okay? His neighbor says, I'm paying $300 a month. My whole family's got coverage. Oh, well then I'll do the same thing. Well, did you notice on the front of these things when it said, the second question number 3 says, is employer coverage available? Okay? Oh yeah, she qualifies to go on the employer plan for $400. The kids qualify to go on the employer plan for another $300. That's $700 a month. Is employer coverage available? Can they get a tax credit? They don't get insurance for $300 because his employer did him a favor and provided health insurance to him. Okay? Now, it's interesting. There are groups, there's a whole ton of people. This was an absolute unintended consequence. I promise you, President Obama did not have that in mind when he was telling Congress to pass this law. I promise you, the senators and House of Representatives that voted to pass that law, they had no intention for that to ever happen. But all they did was pass a $2,700 page bill that they didn't understand, and they passed it off to somebody else. And the rule makers had made this a ridiculously unfair program to try to follow. Okay? We have people, our organization, National Health Underwriters, are trying really hard to get some rules changed on here really, really fast. It says, okay, employer coverage is available, but it's not affordable. Right now, the federal program, and you can go look this up on the internet, it says the way that you calculate if employer coverage is available, is you look at the employee and you look at how much it costs the employee to have health insurance. Okay? The employer pays the $400 for the employee. He's doing him a favor. It's free. Since his coverage is free, they don't even look at how much it costs to add the wife and kids. Oh, that's not part of the calculation. We just look at the employer and the employee price. If it's affordable to him, 9.5% of $50,000, should come out to be about $4,500, $4,800 a year. Should be $400. They should be saying, if the family coverage is over $400, it's not affordable. But the program doesn't look at the family. It looks at the employee. Now, the reason they did that, they were looking at 3 different methods of figuring this out. The rule makers sent out to the world, and we don't have time to look at the rules. Sent out 3 different methods, say, we're thinking about this method, we're thinking about this method, we're thinking about this method. And they said, oh, well, that method there says he's got a job making $20,000 and she's got a job making $30,000. Well, wait a minute. This employer doesn't know how much money this employee makes, and this employer doesn't know how much money this employee makes. We can't gather all that information quick and easy. And since we can't, we'll use some other method that's quick and easy. Because nobody out there really knows that is there insurance offered from both places, and is it affordable at both places? So we just look at one, and that determines for the rest of the family. Now, if they both have jobs and they both have free insurance from their job, they can keep that insurance. But again, now the kids can't. They can still purchase insurance through the exchange, but they have to pay full price for it. So there are, and just think of the cul-de-sac that has 5 different families, and they've got 6 different scenarios for their health insurance, which isn't possible, but it's going to seem that way. Okay? So, yes,
I
ma'am.
have a question on, is the employer coverage available? Ma'am, I'm under COBRA right now. Is that what I have to answer? Yes.
Are you employed with the person who's offering you COBRA today?
I retired.
You are not. That is not employer coverage. That is a benefit from an old job you used to have, but it's not. If you're employed today and the employer today is offering you coverage, it's employer coverage. If you're not employed today, it's not employer coverage. Yes, ma'am.
Okay, my situation would be the same, so I understand that part, COBRA. Okay. Now, I don't have insurance with my husband, but I could have for another $400. However, I think they only have a certain open enrollment time.
Okay.
Which maybe next October or something like that. So would I be truthful in saying insurance is not available for me now? Because it wouldn't be until a certain amount of time?
Ooh. You're actually right there. Technically, from what you told me, you and I both know that you can't get out of that plan. Okay? But I have a feeling that when you and your husband filed taxes in 2015 or your 2014 year, and the IRS looks at it and they say, this is really weird. This married couple here, he has a job, he has health insurance through the job, and she's saying she's not eligible to get out of his plan. Let's do some research there. And they're going to say, yes, you were eligible for that plan. You didn't sign up for it in time this year when you were supposed to. So they may come after you and say, you're going to take your tax credit back. Okay, this is exactly the kind of situation that we're trying to get in front of and try to get to fix. Our first thought was, and it's looking better and better here in Idaho, our first thought was, why can't an employer offer a health insurance plan that says, you can be on this plan because you work here, but you can't add your wife and kids. This is an employer coverage only. We don't cover spouses, we don't cover children. At least that would allow spouses and children to purchase insurance through the exchange and receive a tax credit if they truly qualify for it. Okay? And at first we got all kinds of, there was a whole bunch of, doesn't look possible. It turns out that the insurance companies, they can't create a plan and write a plan that says you can't add your dependents. The federal law says if you offer a group plan, you have to allow children on the plan. We have lots and lots and lots of rules to protect children. We have the children's health insurance pool for the low-income people and whatnot, but you can't write the company, the insurance company, can't write the plan that way. But we've been talking to the carriers here, and they're saying that if your company writes your plan and says that they'll help you to enforce your company rules.
That's what we're working on right now.
Yeah.
One of the things about having a state exchange instead of a federal exchange, we have some of this latitude to be able to do this. I don't know if you guys all remember last spring when everybody was up in arms about this and nobody wanted a state one. Well, this is one good consequence of having a state-run exchange, because now they're giving us some latitude to let the insurance companies do this. So that, but they just don't know how exactly we're going to be able to credit that yet, but that's part of the things that we're working on. And I think it's going to be a real good thing for the consumers.
You know, if the IRS comes knocking on your door and you have a letter from your employer's husband that says, what's your name? Sherilyn? That says Sherilyn is not eligible to be on your husband's name? Don's health insurance plan. If you have a letter from the employer that says that, the IRS is not going to be able to take you to task on that because you have a documented letter from the employer saying that you're not eligible. Okay? That's the word we're getting right now. And everybody is scrambling so much. It wasn't apparent a year ago. No, the rules weren't out. We didn't have these calculators. Now that you plug in all these different scenarios and you're going, an unintended consequence, another unintended consequence. We're seeing these and we're trying to get in front of them and get them fixed. But right now, today, it looks like if a person signs up early on, they're gonna think that this is a totally unfair law. Okay. The thing is, healthcare reform is the law. It passed 3 years ago. The most important pieces of it, really, the biggest piece really is the individual mandate. It does start January 1st. And we're going to help you work with the law any way we can, and we'll try to keep you informed. Again, we're the National Association of Health Underwriters. We're available to anybody that needs meetings. We're having meetings at the Coeur d'Alene. It used to be called the Coeur d'Alene Senior Center. It's now called the Lake City Center. We're there every, one of these pages has it. We're there every Friday morning at 8 a.m. And then we added, we're also going to be there every Wednesday except the second. We're going to be there the 9th, the 16th, 23rd, and 30th at 1:30 on Wednesday afternoons. So, and if we get call from the public, we've done 2 evening meetings this week, and we get more people that want us to do this. We have 60 members from Lewiston to the Canadian border, so there's somebody in your area who would be more than happy to meet with folks and go over this information with them. So, we'll stick around for questions. Yes, sir. We're done with the actual presentation.
Do these health plans